going to hit the record button now. So good afternoon, everybody. We have Dr. Mina here. I'm not going to say her last name, but it's very long. My housemates are screaming in the background, so I'm going to be on mute very fast. But we're very grateful to have Dr. Mina here. She is an FIU alum, and she also went to UF, for those of you who are coming from the UF pre-dental event as well. So any more questions you have, she is very friendly, charismatic, etc. But I'm going to let her speak and mute my mic.
Yeah, buddy. Okay, so I'm going to make this as fun as possible. Hi, my name's Dr. Mina. I try not to keep formalities. So if you call me Mina, I won't be upset. If you see me in the street and say Mina, I won't be upset. That's just to kind of get you guys what kind of feel I want to give. I went to UF. I was actually the interview I thought I bombed because I nearly left crying. I told them that they shouldn't do that to people. I hear that the interview is not as bad anymore. I was heavily involved while I was there. So I know like the ins, the outs, the dirties, the goodies, all of it. I had applied to 9 schools. I got into 2 for sure and waitlisted at 1. But the point is that you can get in anywhere. It's all about the story that you tell. And I'm going to start there. I wrote my personal statement because the way I went to the Nova Pre-Dental Society, there was like a room full of 100 people. They said, who wants to do a mock interview? I ran down. Clearly my personality is not one that's shy. And Dr. God, I forgot his name. It was whoever the dean was. He said, so tell me about yourself. And I said, well, where do you want me to start? He said, start from the beginning. I said, fine. Well, I thought I was Italian because my dad had an Italian restaurant, and then this is literally my personal statement, and I wrote it like I was talking to the dean. It was not like I think I'm going to be a dentist since I was 5. No, God, no. It was just a story. So I was like, I thought I was Italian. My dad had an Italian restaurant, so we had to be Italian. But really, I'm Persian. I'm Muslim. I learned how to tell time because I like Japanese cartoons. Anime is the coolest thing in the world. And then from there, I loved Japanese cartoons and I wanted to study in Japan. So I learned Japanese, and then I got braces, and braces were really cool. So it got me thinking that maybe I should do dentistry because I had so many questions and I thought it was interesting. And then from there, I talked about how I did FIU's Hospitality and Management School has the South Beach Wine and Food Festival. I did that for 4 years, all 4 years I was there. And I got to meet Martha Stewart and Emeril Lagasse and Guy Fieri. And I wrote this in my personal statement. I said, and I did all these things, and all I knew is I still wanted to be a dentist. I talked about how I studied in Japan. So I studied in Japan while I was in FIU's program. Also, I did Japanese culture and language. And I told them that I had a culture shock, and it made me realize even more that I want to be a dentist because I understand what it means to be in a place that you don't feel comfortable. And I have patients from all cultures and all age ranges, and this teaches me how to connect with them even better. And then all in all, the very last paragraph was, every experience I've ever had in my life has made me prepare to become someone who will be an incredible dentist. And now I'm ready to take the journey that will teach me the clinical skills I'll need to be a dentist because I have all the soft skills. That was my personal statement. I even flew out to California because I thought I wanted to go to school in California. The school I was waitlisted at was USC. I did not get into UCLA. I will tell you, someone at UCLA told me do not apply because they don't like their program because they are literally in the middle of Beverly Hills, and who wants to go see a student dentist when you live close enough to be in Beverly Hills? Putting that in consideration, depending on what kind of dentist you want to be. If you really want to be in LA, close to Santa Monica, fine, apply. But I will say it's a rough spot. So that's my my personal statement, which is a lot of my background. I worked at Apple for 5 years also in undergrad. And the program at FIU still stands to be the strongest one I've seen that helps you prepare to get into any of these professional programs. I recommend people to go there on their website to steal the information. It's fabulous, very well organized. Just follow what they tell you to do. And because you get the endorsement, it's like gold stars because no other school does it. Like very few schools do it. As for UF, I still hear, if you want to go to UF, is one of the most incredible programs. We don't believe it when we leave it, but when you get out, people start telling you like, why do you know so much? And I've only been out of school for 2 years. They prepare you very well. Remember, every school is going to try to paint the prettiest picture of themselves. You have to look at what populations live close to the schools, because those are the people who are going to be coming into the school. So like, I'll never forget it. Nova gets a lot of different kind of cases versus what you get at UF, because the population that lives near Nova is much richer than the population that lives in rural middle of nowhere Florida. I did a mission, sorry, not a mission trip, because you can't call it a mission trip. I did a service trip while I was in UF also. So I went to Ecuador and did dentistry internationally. I think their curriculum's changed a little bit. Also, #COVID, definitely different. But you get a lot of experience. There are places that don't do root canals. We do 5. There are places that just don't do any. You get to work on plastic teeth. And I said, how do you graduate someone who's competent in dentistry if they've never done a root canal? What other fun things do I want to say? I practice dentistry in Miami Beach also, so I deal with a very interesting crowd of people. I've worked on like D-list celebrities, and that's really fun. Miami Beach is an interesting place. There are 40 other dentists also on the street that I work on. So there's a lot of it's a lot of competition. There are people who price shop. Working in Miami is very strange. You see some things, you hear some things. I've had convicted felons in my chair because they got too much cash and got out on parole. I got stories on stories on stories, but I will do a really quick demonstration because this is my favorite part. Also, I've done yoga for 15 years, which gets incorporated into the dentistry that I do. If you want, where am I gonna point my camera? Let's see. We're gonna do this. I'm gonna make this active because I love being active. You'll never get this in any dental school you go to. You'll never get this in any like program or anything like that, because it's just, no one wants to deal with it. Sorry for the really bleached background. There's a lot of sunlight, but we're gonna do some movement. So if you want to do it, you can. Can you guys see me?
Yeah.
Yes.
Beautiful. So I'm just gonna shake my wrist, my elbow, and then my shoulder, right? And then bring both arms up and tell me how you guys feel. Or if you don't have to, like, you don't have to say that loud because you're all muted, but I just want you to take that into consideration, right? Okay, you're obviously stunned because one arm is longer than the other, so shake the other side out so you're not uneven. And then the other side. And come up. Okay, so now you're even. I'm showing you that you can change so much with so little. Our body's all connected. There's something called fascia, which is a connective tissue that covers all of, like, most of the surfaces of your body. And if you don't like move it, it gets stiff and doesn't really move. I apply that to the neck and to the head and to the jaw. Like, this is how I treat headache and migraine patients. So I do like therapy and I teach them. So I want you to like move your jaws around, just see like how it feels. Is it stiff? Is it not stiff? Is it tighter on one side, left or right? Okay, I'm gonna go back because now I can do things from here. So you move, you feel that tension, right? So the next thing you're gonna do is we're gonna play with your neck. So we're gonna use your neck to see how that changes the way your jaw moves. So that's front and back. Now tilt your head to the side and notice how your teeth come together. It's not the same. Now go to the other side. Completely changes it. Tilt your head down. And your jaw almost juts forward. Like if you leave it alone and you have a nice loose jaw, your lower jaw comes ahead of your upper jaw. And then tilt your head back. And you can barely pull forward. So your neck position and the muscles of your neck dictate where your jaw goes. Reverse it. Where your teeth are changes the way your neck and your spine and the muscles of the rest of your body move. This is something you won't hear at another dental school. You won't, like, unless you go after it, no one's talking about it. So if you have tension patterns due to the way your teeth come together, it'll affect your brain. It'll, like, you'll get migraines, you'll get tinnitus, all of this stuff. I don't care about cavity preps. You'll learn all about them. This is what I care about. So teeth placement is super important. All you future orthodontists, please listen to me. If you disrespect the location of the teeth and where it is in relation to the jaw and the spine, you will create patients that have migraines, sleep apnea, and all these other chronic issues. Fascinating stuff. So how do you undo it, right? So now let's make our necks and our jaws soft. So you're going to take your hand, and I'm doing this movement, but never actually moving it. So it's called an isometric movement. So I'm using my hand to push into my head and my head to push into my hand, and hold for 5 seconds, and we'll release. And release. I'll go again. And release. And release. Now open and close your mouth. Does it feel softer? Now let's do the other side. Okay, now make sure they're even. We're gonna do the same thing, but you're gonna go forward. So straight, good posture. Push your hand into your head and your head into your hand. So I look like I'm doing the face palm. And release. And release. And one more time. And release. And play with your neck. The front of your throat might feel really soft after that one. Look, I see you, Alex, going like, you probably work out. You got good function. Leave me alone. But there are other people in here like, oh, wow, I feel a significant difference. Depends on also where you hold your tension. So now you're going to make a little basket in the back of your head. And we're going to go backwards. So you push your head back. You should do this one no matter what, because we all are such forward head posture. We sit at a computer all day long. So, and relax. And relax. And relax. Pretty good, right? Your neck just feels better. And if your neck feels good, your jaw feels good. Is anyone willing to put their fingers in their mouth? Is that a thing? It's for the sake of experimentation. If you want like a 5-second, like, hold on, let me go wash my hands, we can do that. I'm gonna go wash my hands.
I'm gonna just use some sanitizer.
Okay, but my question is, why is this even a UF dental admissions like presentation? It should be a yoga session.
This isn't a UF dental presentation. This is DenTalks with Dr. Mina.
Very true. Very true. Accurate.
Before your events kind of mixed up. Okay, I think
I had one expectation and came into something completely different. But you know what?
Absolutely.
I'm not complaining because this is gonna help for finals. So
absolutely.
Oh, same. What final are you guys talking about?
All of them.
Too many.
All of them.
I think I got a C on my last final. My very last final. After I submitted my application, I definitely got a C on it because I did not care. Okay, so I have a napkin because I'm going to wipe my hands afterwards. So the very last tooth in your mouth, right? Just beyond it and like up, like you're going to try to touch your ear from the inside of your mouth. You'll find a really sweet spot that hurts. And like try to, don't push too hard. Just like till the threshold between pain and discomfort. And relax. And again. And relax. And again. And relax. Now open and close your mouth. Alex, I'm watching you. How does everyone else feel? It was painful, right? If I told you that was a muscle, much like your bicep, like if you just like grab and squish your bicep, it doesn't hurt, right? That's a muscle that opens and closes your mouth. And you just touched it and it was like, oh God, why? I don't think anyone here was like, oh, that feels awesome. No.
So
we hold, go ahead.
Would it be behind the last tooth or
your
side?
second molar? Or I mean, you might be lucky having a third one. It's here.
I am.
I don't know. Can you see my cheek fall out? It's here.
Okay.
You'll know you got it because it definitely hurts.
But right behind it where it's still hard or where the gum is soft?
It's after the bone. So you know you're on bone because bone is like nice and
Hard.
tight.
Yeah.
And then it's more on the cheek side than it is behind the teeth. So
Okay.
you pop out just a little bit. And you can massage there. It's like, it's where the teeth, obviously, because you guys don't know dental terms, I'm trying to make it as easy as possible. It's like where the bone ends and like the inside of your cheek starts. There's like a little archway at the very back. It's like as far as your finger can go. But you're like, doesn't your jaw feel softer on that side? Okay, so then you're just gonna slide your finger forward and just like and do this. Because this is the attachment of all the muscles that close your jaw. Okay. Now open and close your mouth. If you can figure this out, your patients won't need Botox also. And then they get all this like droopy face stuff. Okay, so let's go fix the other side. So now that you've seen that it's an entire asymmetrical situation, and one side might hurt or not hurt as much. Might hurt more too. Like my left side hurts less. My right side definitely works harder. And then notice, is the side that hurts more the side that you chew on? That means you're releasing muscle. Fun fact, we should be chewing with both sides. Fun fact. You should do bilateral chewing. No one tells you that. Okay, I'm done. Crazy, right? Super nuts. So I'm gonna be really weird. You guys are gonna see the inside of my mouth. I'm gonna get a light. Add a light. Let's make things really gross. Okay, so then there's a muscle that we're gonna touch that's on the inside of your mouth. Don't try to gag yourself though. So if you follow the tops of your lower teeth, and then you get to a bone, right? And then just on the inside, like you're going towards your throat, don't go to your throat because you will gag. If you go just to the inside of it, there's a muscle that crawls up towards the top teeth. That for some people is super painful. For others, it does not hurt at all. So only massage one side, just like massage it, go up and down, up and down. And you know it's a muscle because it hurt. It's like squishy. It's not a bone.
What's the name of that one? I'm just curious.
Okay, so that one is your medial pterygoid, and the one that we were touching on the outside is your lateral pterygoid.
Okay, thank you.
And pterygoid, by the way, starts with a P.
Yes.
First 3 weeks of anatomy, Indian teachers saying things, and I'm like, I don't see the word that starts with a T. Starts with a P. Definitely starts with a P. Okay. Open and close your mouth. See, that definitely feels different. Mind blown. I had no idea I had muscles in my mouth even after dental school. I didn't know that you could massage these things. Okay. Now I'm drooling because my fingers were in my mouth. But it feels different, right? Since Alex seems to be the active one, I'm going to send him on a mission. Okay. You're going to go touch your toes, or try to touch your toes. Okay? I'm not going to cue you at all. I'm just going to tell you, try to touch your toes and do it like 2 or 3 times so that way we can remove the possibility that you weren't pre-stretched. So just like reach forward a couple times and see how it feels.
I should just touch my toes?
If you don't touch your toes, just like forward bend.
I can touch them. I'm touching them.
I believe you.
Like 3 times?
Just like 3 times, and then the 3rd time stay down there and just kind of take an analysis of where you feel tension. Right? So it might be in your hamstrings, your quads. You don't have to articulate. I'm hoping the voodoo that I'm about to tell you can happen. All right?
I'm listening.
Okay, now come back up. I'm going to cue you now. You're going to suction your tongue to the roof of your mouth, and you're not going to bite down. So you're going to hold it like this. So like there's a little bit of space between your teeth, and then your tongue is like providing support to the roof of your mouth. Okay, but like leave your lower jaw kind of loose, so that way if it needs to move forward or back because of the way you're holding your neck, it can. Okay, do it. Now go reach for your toes. And don't talk till after you're done. Did anyone notice he went down further?
His back is bending more, so yeah.
He's like, yes.
No.
Voodoo magic. I promise you, I teach voodoo. This is what I tell my patients too. So what you just did was you provided support for your spinal extensor muscles from your mouth to allow your entire back line of tension to relax. And when you provide that little bit of space between the teeth, it allows the facets of your cervical spine to articulate better. And because your spine is just one big long piece of string, if there's something that's tied up on the top, there's a rotation that happens on the bottom. So when you relax the top, the bottom also relaxes. And then holy crap, you can go further. So this then translates to efficiencies in exercise, efficiencies in walking, breathing, gait. It provides and lends itself to like optimize athletic abilities, better workouts, more strength, and the whole 9 yards. Okay, I think I'm done. That's like half an hour of me talking.
That was amazing. Well, I'm gonna try to massage my mouth like every night now.
Like the gua sha, you've seen like the little face rollers and stuff like that. Like totally amazing for you. Amazing.
Awesome.
Like totally just like that's so from the outside what you're doing is you have all these muscles that like just need release. We sit there and get massages just and then what if you really get good at it, you'll notice. So I'll even show you in my face. I have a torqued jaw, so like significantly torqued. This is the bottom of my jaw on my left, and this is the bottom of the jaw on my right. Like you can't miss that. It's like a whole finger's worth. So my orthodontist made my teeth look beautiful, but my jaw is. And if you go back to him, there's totally a law that protects him from anything. So I had clicking and popping in both my joints when I was a kid. We're like, hey, can you fix me? He's like, it was there before, it might be there after. Sorry, we don't treat that.
Yeah, that's something that I noticed because I have braces now, and the first thing that they fixed was my placement because my left used to click every single time.
So they fix your placement?
Yeah, Do
you know like the name slowly. Of your orthodontist?
Yazzie, Dr. Yazzie.
Dr. Yazzie. I might have to provide that to a patient because very few orthodontists pay attention to it.
Yeah, I didn't even notice until one day I was like chewing it and I actually like chewed, I think, faster, and I was like, wow, like it's not clicking like on my left side anymore. I thought that was awesome. And I went back, she was like, yeah.
Dr. Yazzie, where do they practice?
In Kendall.
Okay.
Like Miami. So
yeah, I mean, I'd hope that you're not flying ortho, but there are people who do. What else? I bet you guys have like 1.5 million questions or not, and you can ask me anything. I'm like open book. I will tell you like the real deal on UF. I can tell you how to apply to dental school. I could also, by the way, I coach people to get in. Not like there's one girl right now that I'm helping that's at UCLA, and I helped 2 people before that. It's not like I don't charge people. I just coach them like, hey, you can do it. Just got to make sure that you know what you're doing. If you really want someone to pay for a service, I know someone who does that, but I would never pay someone. Cool beans. All right, you guys are like hella cool.
I guess I do have a question.
Yeah.
What is it like working somewhere that has 40 dentists in one place?
It's really annoying because they will literally walk from one office to the next looking for prices. And like, they're like, well, the guy down the street does it cheaper. I'm like, well, then go to the guy down the street. What can I do? Like, I don't make my numbering, my boss does. I'm like, why don't you take my insurance? What it does, so when you have that much talent in one street, it makes you specialize. So I know what I just taught you because my boss taught me, because he's like, everyone here can do veneers. Everyone here can place implants. We need to differentiate ourselves. So he went and learned all this really cool functional stuff.
Sweet.
Because there are definitely people who don't want Botox. There are definitely people who want to we get like MMA fighters and stuff like that because they want to optimize their spinal positioning so that they can recruit and activate their muscles. You do a few of these like neck and head things. Next time you go lift, tell me how much more you can lift. It's true.
So did you learn all this at UF? No, right?
No, zero. None of this came from UF. I get invited to UF to like go open the dental students' minds. I have a really good relationship
like a course.
Excuse me?
Did you take like a course on this?
So there's a division, there's a type of dentistry that this falls under. Mm-hmm. And basically I've fallen upon that philosophy. So sorry, men, this is definitely a woman's question, but like, you know how certain nail techs do things with cuticles and other ones don't, or they'll like dip your nails one way or not dip your nails another way, or they'll do your manicure one way or the other, and you end up picking the one that you like the most? Dentistry is exactly the same. There are a bunch of different schools of thought. Not one is correct, but not any single one is incorrect either. Their methodology works for a set of people, and there are other methodologies that work better. Mine is a very, very, very specialized division because the number of people who are willing and able to figure out that this is the reason why they have issues with their migraines and headaches and their tinnitus is super small. But when they're debilitated, they're heavily debilitated, and they get upset that they're on 14 different medications because this medicine does this, which is why they need another one, and after that. But there are people who are perfectly happy getting Botox. Botox is an incredibly accessible treatment. There's a division of dentistry now that is specifically like, that is the gold standard treatment for facial pain. And like what I do is considered like unconventional and experimental, but you guys just saw it's so accessible and so easy to understand that it's not like voodoo at all, but it doesn't make money like Botox does. You will feel at some point very bombarded with am I doing the right thing? Am I not doing the right thing? How do I even know? Basically just kind of, you got to pretend that you know what you're doing, and then it works. And then for some people, when it doesn't work, you're like, I got to go Google some stuff. Real facts, I learned more on YouTube than I did in dental school. Yeah, anatomy class for sure. Anatomy and physiology I learned on, hold on, I have to ask my sister because, oh, what's his name? Crash Course. Crash Course basically taught me anatomy and physiology. There's another guy that does anatomy dissections online. Yeah, I would dissect in class, but I had no idea what I was doing. So I'd go rewatch everything or looked at the tag dissections because that's how you're going to get tested. Yeah.
So, like UF like was really
UF is incredible. Like UF actually is incredible, but I'm very auditory. I love learning from hearing and YouTube. There are just people on YouTube that are better than your professors. Khan Academy, let's be honest. How many of you have used Khan Academy?
I have, yeah.
There are people who know how to teach. There are brilliant minds out there, and be prepared. You will have professors that are like strikingly brilliant, can't teach. Sorry, that's my family. And you have to learn how to navigate that. Like, you're not going to understand the way they speak, so you need to go learn it a different way. Also, every dental school sucks while you're there. Every single one. No matter which dental school you go to, you will hate it. It will be one. We call it the struggle bus. The hot mess express is what my crew and I called it. But basically, you have to remember that every dental school's job is to graduate the class. So the likelihood of you falling behind is very low. Once you're in, you'll probably get out unless you just decide to give up. And they all suck. They all seem like they're out there to get you.
So is there any specific thing that you recommend when applying to UF?
They've changed some of their stuff over the years since I've been there. But show them that you have, show your colors. Don't be afraid of not fitting their mold. They want so they've been doing this for half a century, right? So they know that they need a little bit of salt, a little bit of pepper, a little bit of garlic. They know that they need every kind of person in their class because not everyone in the class is going to end up doing the same thing. You have people who become periodontists, you'll have people who end up becoming researchers, you'll have people who become ortho, endo, blah, 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 blah. So it's not a one size fits all. The weird thing is, statistically, is in that year that you're applying, how many of you are applying? Like how many people who are like you, who have the same story as you are applying? So when I knew I wanted to be a dentist since I was 13 or so. And I was like, I don't care. I'm not going to follow any traditional route. I always asked, my only goal when I was going through life was, what do people regret that they didn't do by like X age? And I would just go do it. And I told myself, how does this little piece of my experience come back to my main goal? And that's all I ever did. I just rewrote what I learned from every experience. As I said, culture shock from Japan taught me how to talk to people. Working with celebrities, I work with celebrities now. Thinking about how dentistry works, very good. Working at Apple is customer service. How do you sell something? Dentistry is selling. You have to sell your treatment. Do people have value for the words that are coming out of your mouth? Do you know how to be professional? Do you not know how to be professional? There are patients, and I learned this at Apple, there are people who want to be spoken to formally, and there are people who don't trust you if you can't show them your true colors. If you've noticed, I've gone from very formal, nice to meet you, to let's get down and have fun, to we can be formal again. And people want to see that you're dynamic, that you have a life outside of being a student, and that you've made an endeavor and you've been very thoughtful as to why you want to become a dentist. And you can show that. Show all of your sides. Sit there and think about, like, when I go running, you can literally apply anything to why you want to be a dentist. Every single thing.
Thank you so much.
Welcome. If you need help, I this is what I do. I like literally sit there with people, like, tell me the most boring thing you do. And I will make it apply to dentistry, and I'll make it sound fantastic.
Thank you.
Sorry. Welcome. Alex or whoever has my email, you can take my email, find me on Instagram. I'm very accessible. I will read you my favorite quote. I probably deleted it now because I'm awful. Oh, I know who has it. Abigail has it. It's, how do you make things sound fluffy and important? Oh, yes. It's such a good one. Okay. How do you tell? How would you write, I changed the light bulb on your resume? I changed the light bulb. Single-handedly managed and successfully upgraded and deployed a new environmental illumination system at zero cost overruns and zero safety incidents. Change the light bulb. You have to be able to do that with your application.
Yeah, that was good.
10 out of 10.
And that's it. It's like, how fluffy can you make yourself? How important can you be? Can you be eloquent in that step? Because let's be honest, like, we all went to school, we all struggled during school. All we knew that we had to do was apply to dental school. And in between, we did some, like, randomly cute things. It's how do we highlight those randomly cute things to make us seem so much more important? Because we are. It's like this glaring light back here. Who wants to go ahead?
No, go ahead.
No, please. You were about to say something.
Okay. Okay, so actually I went to, you were mentioning that you like welcome the dental students at UF. I went to the alumni meeting that you were at like a couple months ago or something like that.
Okay.
But yeah, anyway. No, you were there, no?
Probably. They like literally email me all the time and I just say yes. And because it's Zoom now, I don't have no idea who's there.
Okay.
So,
well, I have a question because like I'm also going to UF, but also even for dental schools in general.
Oh, because you've already accepted your position?
Yeah.
Okay. Yeah. Okay, I remember that one.
Yeah, it was the accepted students one, exactly.
That's it. Yeah.
Something that I feel like I kind of worry about now.
Sorry.
Huh? Go ahead.
Congratulations.
Oh, thank you. Something that I feel like I kind of worry about sometimes, and probably everyone else here does, is like when it comes to manual dexterity, because we all do like, you know, like little art projects and stuff. But at the same time, like once you actually are there, like sometimes I feel like my hands are shaky when I'm doing something, but I wonder if like that'll get better because you just practice for hours or like what? Like that's what I'm worried about.
Okay, so stop worrying. First thing, you have to, this gets me in a lot of trouble because people don't like that I say it, but here's the thing. I had an interview question at one of the dental schools that was, what's your biggest fear about going to dental school? And I said, the lack of fear. And they gave me like this big wide eye. I said, why should I fear something that tens of thousands of people have done before me successfully? Why should I have fear? It is their job to make sure that you know what to do. That's why you pay them. You literally grab someone by the neck and say, I can't do it, teach me, if you're really struggling that hard. And don't have fear about it. If you own your own education, that's the very first thing I want you to learn. Own your education. You pay lots of money to be there. I would fail exams on purpose at UF. Don't tell them I told you this. I would fail exams on purpose because I wanted to hang out with the professors. I wanted more time with them. Be a rebel. Like there's nothing holding you back in this world. Nothing. So if you want to learn something, you can find someone who will teach you. UF has an entire tutoring program. You can request a tutor. I was a tutor. This is why I was like rubbing my hands while you were talking about it. My very first psychomotor, my hands were shaking because I put the teeth in the wrong place. So I started half an hour later than everyone else because she said go, and I realized that I had done this with the teeth. So I had to, like, people think you're cheating. I'm touching everything that I shouldn't be touching. So I called the professor over. I was like, hey, I did a boo-boo. I need to fix it. I switch everything. Literally a waterfall of water was dripping down my back. My hands were doing this. Like literally, I could not control them. I'm going to teach you all how to make your hands stop shaking. Because I got the second highest score on that exam. It is the power of the mind. It is the power of mind. So everyone, we're going to do this together. You're going to curl in your fingers and make a really tight fist. Then you're going to bring it up and just like overexhaust your muscles and just hold it. And then you're also going to curl your feet and curl your toes and curl your calves against the chair that you're sitting on. And like really, really tight. I close my eyes too because I'm just trying to de-stress. And take like 5 deep, 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 like really big Buddha breaths. Like your belly button's going to touch the wall if it could. Okay, y'all back. How soft does everyone feel?
Much better.
Yeah. So hard. Like I thought I was gonna like tear like my left bicep, but it was like hurting like on my bicep. It was pretty funny.
Also, no one ever do arm wrestling ever again. I literally had a classmate who did a spiral fracture and has a bar in his arm. So no arm wrestling for anyone here, period. Do not arm wrestle. But that's how you stabilize your hands. Like that's it. If you feel like that, like it's your nerves, just de-stress and tell yourself you can do it. It is cutting a box. And if you sit there and tell your, like, the more you freak out about it, the harder it gets. Just like cut a box. And if it's not working, like you've cut 20 of them and it don't work, walk away. Please just walk away. Go have dinner, go paint your nails, go watch a movie and come back. That's how, because yeah, in preclinicals, you're going to be like, it's not perfect. In real life, none of it's perfect. None. None of them fit the measurements anymore. So you just need to be able to like, what it teaches you, what those like skills are teaching you are, can you see it? Can you check it? And can you evaluate when you're like good enough? If you're really trying to be the 97 or 98th percentile, fine. Go kill yourself. But the really healthy like A- range is not hard to get. You just have to be like steady minded enough for it. Does that make sense? If you can control your mind, dental school is easy. Super easy. Also, if you're single when you start dental school, I don't recommend trying to date anyone in the first semester, at least. Like get your footing down first. It's scary to watch people like fail exams and like lose relationships at the same time. I stayed single the whole time. Like I willingly chose to be single so I could like have fun and not stress. Yeah. But you'll learn. And if you can't learn, don't be afraid for asking for help.
Yeah, I figured it'll all work out anyway, so I like keep reassuring myself. But I figured it'd probably be like the most reassuring if I asked you, since you literally like were at the same school and you had like the same experience and whatnot. So yeah.
It's a personal thing. There are people who cry, like literally are crying during the exam, and you're like, bruh, it's a plastic tooth. Like it can't get mad at you. Just woo-saw. Woo-saw, like literally learn, especially for clinical stuff. Because it's not memorization. It's not like a bio exam. It's not a biochem exam. It's not an immunology exam where there's right and wrong answers. It's just you and a piece of plastic. And you just go and walk out. People leave dental school. It is totally a thing. And you just have to remind yourself that. If you can like own it, you're good. Because nothing will be scary to you at that point. Don't overthink it. Dentists cut like the manual dexterity stuff. Dentists cut cavity preps in less than 15 minutes. They give you 2.5 hours. I took my board exam. They give you 8 hours to do your board exam. I finished in less than 3. Because I was just like, cool, let's go. Because the more you sit there and stress and try to refine and make it perfect, you're going to screw it up. You will. Guaranteed.
It's so funny because like, so I do wax ups, like when I get bored and stuff, and I'm also such a perfectionist and it'll be fine. Like I'll look at it and I'm like, okay, it looks like a tooth. Like it looks pretty solid, you know, I'll take a couple of pictures, whatever. And then like, I'll come back to it the next day and I'll be like, man, this looks so bad. And then I'll just like start touching it up. And once I start touching it up, it just all goes completely down south. And I'm like, why did I do that? And every single time I've done that. Like until now, like if you look at all the ones that I've done, they're all messed up now because I just touch them and they're like gone.
Literally don't touch. Like if you're like, okay, I'm done, allow yourself like 1 or 2 edits and that's it. You have to stop. You literally have to stop. Anytime I've tutored anyone, they're like, but no, it is passing. Just take the grade and leave. No one's gonna ask you what you got on that one test. No one. No one. You can't put it back. Can't do it. Also, waxing is only like 1 semester.
Very, yes.
It's 1 semester, not even the whole semester. I would watch movies and wax because I really just like, this is so, oh my God. It's more about training your eye and knowing, so you can actually get really high scores if you can see what's wrong with it versus making it perfect. Because if you can acknowledge what's not good about it, you can get a higher score. So keep that in mind too. Like it might not be perfect. Fine. It's not worth like getting gray hairs over. Definitely not. Okay? It's not worth it. I got those after I left dental school, by the way. Those were parting gifts. Did I ever have sleepless nights? I don't think so. Not really. There's a way to like not freak out. We also did wine night with my girlfriends every Wednesday. Towards the end, the beginning, you're just like exams all the time. And you have to find your flow. Like really find your flow. UF hired me to like talk to people and teach them how to organize. So actually you might see me in orientation too. I did a lot of stuff for UF. I like go over my agenda because I just plan things a lot. Because I don't like added stress. So I would plan for like, this is when I'm gonna hate life, and then this is when it's gonna be awesome, and this is when I'm gonna hate life again. That's how you have to deal with dental school. Otherwise, it's gonna suck. If you just sit there and stress about it the whole time, it's going to suck.
I feel like I do that sometimes too. Like I'll look at my planner and I'm like, okay, so I have all these things due here and like I have this, so I'm gonna have a really stressful week. So we're gonna mentally prepare ourselves for that week. I mean, that's a personal thing, but
So I don't know if UF still does this, but they basically would book all your exams in 1 week. So that meant the weekend beforehand really just sucked, period. The weekend after, I binge watched like 8 movies. while I would go in to do practice, like preclinical stuff, like on my Dentiform, I put movies on. I'm like not trying to stress about it. It should be something that's fun. Just like don't. There are people who would like write notes on like how they would do it. I'm like, bruh, cut a tooth. It's not, luckily, we're not brain surgeons. Not sitting there like reattaching nerves. Also, teeth get really big. Like teeth are really small, but when you work on them, they get like this big. The zoomed in nature of it. Ask me anything. I will literally answer it.
I have a more direct question. So, what was your interview experience over there?
Did you hear me? I cried. Like I literally walked out thinking that I didn't get in.
Did you get the question, like that whole procedure question that everyone freaks out about? Because I know that's like the one question that everyone's
What's
like,
the procedure question?
like they'll basically ask you, what's your favorite procedure? Yeah, explain it. They have like, I feel now there's like different variations on the question. So some people might get a different, like an
No,
easy.
I got interviewed when they would do interrogation. So I got asked why dentistry 8 times.
Okay.
Like, why do you want to be a dentist? Why do you want to be a dentist? Why do you want to? I was like,
What did you answer? I'm curious.
I think I told them that like I decided when I was a kid, it made a lot of sense to me. It affords, I was very honest, I was like, it'll afford me the quality of life that I'm looking for. I get to interact with human beings. I get to work with my hands. I get to be my own businesswoman. If I choose to give back, I can. But I didn't say all of those in one sentence, like in one answer. You have to hold yourself. Hold yourself from giving all the data the first time. Because if they're going to ask you a couple times, you got to be ready. I also remember not sitting back in the chair. Like I'm sitting back in my chair right now and comfy. I definitely sat on the very edge of it. And I was like, yes. But they don't interrogate anymore. They don't interrogate anymore.
What's the style that they have right now? Like, I don't really know.
It's still a panel.
Yeah, I mean, it's always a panel. I mean, you would know better than I do then, because if you interviewed already.
Yeah, since I just did it this year. I mean, I thought it was normal. I didn't feel overwhelmed. Like you're nervous, obviously, but like, I didn't feel like interrogated at all. Like they were really nice to me.
Do you remember who you had?
Yeah.
Like, if you don't remember their names, that's fine. But like,
no, I had Dr. Sandow. Like she was leading it.
mm-hmm. I think they run 2 groups at the same time now. So some people get Sandow and then some people get the other one. And then there's normally like some faculty and stuff that shows up.
Exactly.
Yeah. I just remember I had Susan Nimmo. So she's the head of the Women's Association also. And it only occurred to me after she became my advisor for the club that I was like, oh yeah. I couldn't remember my interview. Like I could not. I had blocked it out so hardcore, like psychologically, that I didn't remember anything. I didn't remember the rest of the day. I just remember that my interview went terrible. I was super sad, and I don't remember the rest of it, period. And I chose to stay with some of my friends who lived in town, and they definitely tried to get me drunk because they're like, your nerves are all sorts of messed. It's like, no, I can't drink. I can't drink. Can't drink. Also, I definitely hated Gainesville when I got there. Being from Miami, I definitely hated it. I was depressed for 3 months. So be prepared. Just know if you're going to the small college town in a place you don't know and everyone's weird, like they would pray there was like a large group that would pray before exams, and I had never seen that in my life before. So I felt like, am I the weird one? Like, why am I not in the group praying? What memo did I not get? Also, I grew up in Aventura. I'm like from Aventura, Miami area, and everyone's Jewish. Like I did not ever, I'm like the token Muslim, and that's it. And everyone else was Jewish growing up, and they don't like outwardly pray or anything like that. So when I got there, and there's like big Christian groups, and they were handing out like bracelets, like pray to Jesus, he'll help you get through dental school. I was like, whoa, what? This is public university. I'm so confused. So definitely a culture shock for little bits like that. But then those same people became really good friends of mine. So I see you talking, Maya, but I don't know what's going on.
I'm talking to someone next to me. Ignore me.
They also stopped praying after like the first semester, which was it's just interesting. It's a very cool place. And I know there were some schools that would get mad that we would do a lot more. Like UF really does get to do a lot. Not saying you have to go to UF. It's also cheaper. The main reason why I went there over Nova was because it's cheaper. My parents were like, no, if you stay here, it's still cheaper than if you go there. I said, no, it's definitely cheaper if I move to Gainesville. Definitely cheaper. Unless that new, whatever the bill was that forgives student loans gets passed, I still say go for your cheapest school. Literally just apply to the cheapest, like take the acceptance for the cheapest school. That's the other thing I'll say. When you got over like 300 grand in debt, you really don't want to deal with it. And going to UF gives you the opportunity to not be that bad. See, Alex, I told you I don't need a presentation.
Oh, you did pretty good today. I'm impressed.
Not dry. Do you want me to tell you guys procedures? I didn't know that they asked that.
I think honestly, it's the way you kind of approach it. I know like a D1 there right now, and he told me that he kind of, I don't want to say rerouted the question, but like he rerouted the question and just sounded really intelligent, and like he knew what he was talking about. So like there's ways to kind of go about it. They're not expecting you to ultimately like be able to.
No, of course not.
But I feel like a lot of people just get intimidated by it, and it's a really big thing. Like when everyone thinks of UF's interview, that's the one thing that comes to their head. That's the one thing that came to my head until I started talking to students that are there now, or people that have been accepted. So I don't know.
I don't know if they mentioned this. If you get an interview at UF, they're just trying to see if you fit what they're looking for. Like, does your personality match the class that they're putting together? They're not. If you get an interview, that basically means that they would accept you. It's just, does your personality match? So let that be like I'm here to get in. And like ride your confident pony in. Because I definitely didn't know anything about procedures. And I would reroute that answer.
Ironically, in mine. Oh, go ahead.
Go ahead. No, go. You have the story.
Ironically, in my interview, like when Maya said there's variations, that was kind of my situation, in that I was prepared to explain it because that's what everybody says. So I was like, yeah, I'm just going to talk about like a filling or whatever. And then they asked me like, well, Dr. Sando asked me, what's your favorite procedure? And then I said like fillings, because like it's personal too. But before like I actually answered, she was like, let me be clear. I don't want you to explain it. I just want you to tell me like, what's your favorite and why? She was like, please don't walk us through the procedure. So like, I feel like they know about it. So yeah.
Yeah. I mean, to be honest, I love cleaning teeth. While I was in dental school, I'd get so pissed when I would see a cleaning on my schedule. But as a practicing dentist, it's so satisfying because have you ever watched the TikToks or the videos of people who pressure wash like dirty sidewalks? It's like that. It's like this really strange satisfaction. And I just love it. I really just love cleaning teeth. It's so mundane. Like it is the most not sexy thing you can do, but I love it. Like I don't get mad now. Yeah, it doesn't make me the most money, but my patients giggle with me. I tell them like, ha ha ha, you have a dentist cleaning your teeth. I don't know what I'm doing. The hygienist does a better job than and we just laugh the entire time. I put music on. Um, depending on if they have like a lot of staining. I have a Profi Jet that has baking soda in it. So sometimes I'll use that instead of the Profi paste. And we just sit there and laugh the whole time. Like it's gonna get really salty, just like me. And I just make it fun. And then sometimes I really hate fillings. I had one the other day. I looked at the patient, I was like, I don't even know if I want to charge you because this one's so bad. Yeah. How many people do you guys get that are like really dry dentists, or are most of them really dry?
Most of them are pretty. They're definitely not as like you definitely were not what I was expecting today. But like most people fit the mold. You don't fit the mold.
Well, oh no, I'm not gonna say anything. Maybe if we ever cross paths again, I'll tell you guys what's happening in my life. But is anyone an engineer or a computer scientist or anything like that? Computer science background? God damn it. Okay.
I took one computing class for my major.
Okay. If you really want to impress someone, go start doing research on dental AI. It is the future. It is the future of dentistry. People are going to like refuse it head to toe, but there's hundreds of millions of dollars being thrown at it. And I would like, I don't really even have a tech background, but I've been like brought up in 2 conversations with different companies to work for them as dentists in tech. So I'm going to drop that piece of knowledge right here. And I hate saying this because I don't want to scare anyone, but you might get to the end of school and not love it. So don't feel bad. Like I said, take my number, give me a call. Oh, other fun things. I've sliced my finger open and I'm numb on my dominant hand. Can you see the scar? I'm literally numb. Like I can't feel it. I had an accident during COVID. My making coffee like I do every day, the ceramic pour over shattered in my hand and they sliced my thumb all the way through the nerve. And now I'm numb on my dominant hand. This is the hand that I do dentistry with. That's why I said, don't freak out. So that's a thing. When that happened, I thought I wasn't going to be able to practice anymore. So I started looking into all these different things that you can do in dentistry. So if you're in dental school, no matter what finish, unless you're like truly depressed and you hate life, give me a call. I will help you through it. A. B. There's so much you can do with a dental degree. It is not the end of the world if you finish school and you don't love it. Okay. Because you might hit a nice golden point where like, why did I pick this? And know that there's millions of opportunities out there.
Awesome.
Sorry, that was like a little grim, but it is definitely reality.
No, definitely. We all need to understand that side of dentistry because obviously, we get a very one-sided picture of it a lot of the time. Mm-hmm. So
people don't talk about like it definitely can put a toll on you a lot, especially like my group that we graduated together because it is COVID. It is hella depressing sometimes because you see all these people who are like, oh my God, dentistry is so great. And like I'm basically struggling because patients don't come in because it's so scary for them. So if it doesn't feel like if it doesn't feel like roses and cotton candy all the time, because it's not, it's really not. You are a practicing clinician, you deal with people's issues. And sometimes you get to the end and you're like, eek. Also, some people like public health more than being corporate. It's all right to like question where you are in life. It's totally normal. Existential crisis. And don't go ask the happy dentist, like, are you on the right path? Because they'll be like, but dentistry is great. Sometimes you need someone who has perspective, and I don't mind sharing.
Thank you for that. I really appreciate that. Like personally, I love that realistic tip because it's something that you have to hear anyway, like no matter what, because sometimes you do get just one side of dentistry, which is what they try to do. They try to sell you the roses, and like that's not necessarily the case all the time.
They smell good till the roses die, and it's like I need more roses, and then they're not there for a while. Or you literally, I thought my career was over when this happened. Like, I'm done. And then I couldn't bend my thumb. I couldn't hold a handpiece for like 2 months. It was super scary. So if for some reason you have an issue like that, or you're having like a dark spot, take my email, find me on Instagram, be like, hey, life, and I'll help you come back.
So question, what did you do about your thumb?
What do you mean, what did I do about my thumb?
Like it just got better over time.
Oh, I looked at myself and said, you don't really want to figure out how to do dentistry the other way. So I did therapy. So I have like full mobility back. I just can't feel it. But for a while I was like,
I actually also cut my thumb on my dominant hand in a kitchen accident. And it was like by the corner there, and there's like a scar now. And I could move it, but it hurt for like a couple months. So I was like also worried about that. I was like, my career prospects are looking real interesting right now.
I mean, so there's like dental radiology, there's dental tech that's coming up, there's 3D scanners and 3D printers. There are people who work at, don't forget, Colgate and Palmolive and Procter and Gamble, Crest. Like there's so many companies out there. If you don't end up being a clinician, yeah, your path might not be like go work in an office. They exist. It's just so very little people do it. And if you don't know someone who can help you, it gets scary. I'm not saying that I have all the answers, but I definitely, because I've done it now, I started calling 1 million people.
It's 1 million.5.
No, it's not 1 million.5, Siri. Oh my God. But yeah, it is definitely after 6. I will happily talk to any of you guys over again. Also, you specifically, Sarah, do not study. Do not like try to prepare for dental school. Enjoy as much as you can this summer. Like literally nothing dentistry, nothing grad school, no. Go have fun.
That's my plan for once at least. Some of my classmates in my cohort are going to do the research program over the summer. And I was like, no, I'm just going to try to enjoy my summer, even with COVID, but I'll try my best. Yeah.
Yeah, I mean, just no. People are like, I studied anatomy all summer. I'm like, you idiot.
Yeah, like, I know. I already know I'm not doing that. No.
You're going to leave school with so much responsibility. Be irresponsible right now. Like literally go be irresponsible. Oh, also I broke my foot. Sorry. This is I'm all stories. My life is a story. I broke my foot. I also did surgery on a broken foot. So anything can be done. Don't ride motorcycles necessarily. If you don't know how to ride one, don't go learn. Okay, we are way past due. Alex is looking at me like, yo,
it's all good. It's all good because I'm sure everyone is very entertained today. But we'll probably wrap up this meeting here, Dr. Mina. Thank you so much for your time today.
My pleasure.
Your email is in the chat for anybody who didn't see it. I just reposted it again. With that being said, I guess everyone can kind of leave now. But thank you very much, Dr. Mina. This was amazing.
I hope you all become very fabulous dentists, or if you so choose to change your mind, that's totally fine. Bye.
I'm sure we will.
Bye. Thank you so much.
Thank you so much.
My pleasure.
Thank you so much.